everybody, because we had quite a few signed up. So I'm very pleased to have with us today Dr. Laurence Carmichael, and he's going to talk to us about, in keeping with our theme about the immune system and how we can build our immune health, he is going to talk about the area of sleep and how that impacts the immune system. But not only that, what can we do to get better sleep? So before I turn it over to Dr. Carmichael, just a couple of logistics for my participants. We're going to try something new today with attendance. So if you are a Roar for Wellness member, I need for you to, in your chat, instead of saying present or here, type RFW. As we found, we're actually having to sort through who participants are to award their points versus who's just attending. And they're not in the program, so they don't get points because we really allow anyone to attend. So that would help us greatly, because you may have noticed we have not updated many of the attendance for the sessions previously. There may be one that's out there updated where your points are, and we will get that, but we're having to sort through. So if you are a Roar for Wellness member, type RFW, and then that's all we'll need. Anyone else attending, please let us know you're here, and you can say here or present, and that way we have a record. And you can remain muted. If you have questions for Dr. Carmichael, type those in the chat as well. And if there's something, he is open to answering things in the middle of his presentation, as well as at the end. So type any questions that you have. All right, so now I'd like to introduce Dr. Carmichael. He is a pulmonologist in Sheffield, affiliated with Helen Keller Hospital and with the sleep clinic there, and he has over 32 years of experience in the medical field. Dr. Carmichael has more experience with specialties such as pulmonary vascular conditions, sleep disordered breathing, and lung disease, institutional lung disease, than any other specialist in the area. So we're glad to have him, lucky to have him in the Shoals area. He graduated from the University of Alabama School of Medicine and conducted his residency at Vanderbilt University. And he is board certified in internal medicine and pulmonary disease. So Dr. Carmichael, pleased to have you, and I'll turn it over to you.
Thank you. It's a pleasure to be here. This is my third opportunity to speak to this group, and all three times it's been on my favorite subject, sleep. And today's topic was given to me a few months ago, sleep in the immune system, which is a very interesting concept, that sleep is integrated with the immune system. So we're going to talk today about some historical points, some definitions of sleep and how sleep is organized. We're going to talk a little bit about sleep and how the sleep and the immune system are integrated. We're going to talk about specific disorders of sleep and some specific disorders of immunity and how they interact. And lastly, we're going to talk about ways to improve one's sleep. It's been known since of all time that sleep and immunity were somehow related. In 350 BC, Aristotle remarked that sleep is induced by hot vapors that arise from the stomach during digestion, and that similar responses can be observed in feverish patients. So patients with fever in 350 BC were recognized to have increased sleepiness. In 1909, Ishimura in Japan and Piron from France determined that sleep could be induced in well-rested dogs by injecting the cerebral spinal fluid from sleep-deprived dogs into the well-rested dogs, and it made them sleepy. In 1975, Pappenheimer extracted a substance that he called factor S, I assume for sleep, from the cerebral spinal fluid and the brain tissue of sleep-deprived animals. That substance was later identified as a miranal peptide, which is a sleep promoting chemical. And so it's through history, we've determined that sleep is really an ordered and active process. It's not something that happens spontaneously. That means that at the end of the day, we're not just bored to tears and we sleep. Sleep has specific restorative properties. So the definition of sleep is a reversible behavioral state of perceptual disengagement from and unresponsiveness to the environment. Now that's usually, but not always, associated with closed eyes, with laying down or recumbency, quiescence, or loss of consciousness. We note that some fish, and especially aquatic mammals, dolphins and whales, have what's called hemispheric sleep. That means one side of their brain is asleep and the other side of their brain is active or awake. And the reason that that happens is so the mammal can surface for air while they're sleeping. If they're sleeping underwater, they have to surface to breathe, and then they go back underwater. Now, horses and some elephants sleep standing up, and some sheep sleep with their eyes open, thought to be a protective mechanism. Now, some basic sleep survived evolution, despite being a potentially dangerous state of prolonged consciousness. So think about it, if you're a small animal and you might be somebody's supper, that if you fell asleep, that you might be at risk of being taken. We spend a third of our lives asleep, which is a considerable amount of time. Sleep is an orderly process. It's not a random event. We have different kinds of sleep. We have non-rapid eye movement sleep, comprises most of a human sleep, about 80%. We call REM sleep, non-REM sleep, quiet sleep. It's further subdivided into 3 stages, stages 1, 2, and stage 3, which is a combination of previous stage 3 and 4. And there's a portion of sleep called rapid eye movement sleep, which comprises about 20% of sleep, and it's active, is what we call active or dream sleep. And the EEG, or the electroencephalogram monitoring of the brainwave activity in REM sleep, looks much more like the awake state than the non-REM sleep state. If you look at the levels of consciousness during sleep, you can see the awake state, the level of consciousness is obviously high, and it decreases with each stage of non-REM sleep. When we get to slow wave sleep, which is a combination of stage 3 or 4 that we reclassified as stage 3, and REM sleep, where our level of consciousness actually goes back up, and our level of consciousness is about equivalent with light sleep in the non-REM stage. To give you an idea of how our sleep is distributed throughout the night, we enter sleep through non-REM stage 1. In the first of the night, we go through stage 2, 3, and 4 of non-REM sleep, about 90 minutes. In the sleep, we have a very brief REM episode, and those REM episodes recur in intervals of about 90 minutes. Most of our non-REM sleep occurs in the first part of the night. Most of our REM sleep occurs in the latter part of the night. So it's fairly ordered, and this is fairly consistent between people, whether they have sleep disorders or if they sleep normally. So there's hypotheses for the function of the different stages of sleep. Non-REM sleep is thought to conserve energy, restore the central nervous system or components of the central nervous system, such as the frontal cortex and glycogen stores. The body and brain cools during non-REM sleep, and non-REM sleep promotes immune function, and we'll talk a little bit about that in a minute. REM sleep is thought to enable psychological and emotional adaptation through dreams. It facilitates the CNS development by endogenous stimulation, It compensates for non-REM sleep by reversing brain cooling, reversing quiescence, or restorative activity. And because of the higher levels of consciousness during REM sleep, it provides a sentinel role because it's easier for the person to wake up periodically during REM sleep to assess the environment to make sure they're still in a safe place, in a safe position. If you look at sleep and mortality, in over 40 studies involving 2 million participants, short sleep duration and longer sleep duration in both men and women are associated with increased all-cause mortality. If you look at the hazard ratio of 1, which is the individual's relative risk of dying compared to the general population, people who sleep short periods of time have higher hazard ratio of death, and people who sleep an excessively long period of time also have a higher hazard ratio of mortality. So sleeping too little and too much are both hazardous. So we're going to shift gears a little bit and talk about cytokines in sleep. Cytokines are small protein molecules involved in cell signaling. Now, this may be a cell talking to another cell really close. That's called autocrine. And this may be a cell talking to another cell in another part of the same organ, and that's called paracrine. Or this could be a cell in my brain talking to a cell in my gut, and that's a distant cell. So that's an endocrine messaging system. The cytokines turn out to be the principal messengers of the immune system. And that's happened in my lifetime, that we've identified these cytokines within the last 25 to 30 years. Before that, we knew that we had an immune system. We thought we had antibodies and attack cells, and that was it. Now we know that cytokines are the principal messengers of the immune system. The cytokines modulate immune responses. They modulate inflammation, cell growth, cell maturation, and normal physiological functions. The cytokines actually provide the link between sleep and the immune system. There are a number of cytokines that have been demonstrated to affect sleep. We're not going to talk about all of them, but of these, interleukin-1 beta and tumor necrosis factor alpha have been studied extensively and are involved in the regulation of spontaneous sleep. Neurons that are immunoreactive for interleukin-1 beta, which we'll call IL-1 beta, and TNF, or tumor necrosis factor, are located in brain regions which are implicated in the regulation of sleep-wake behavior. And those brain regions are the hypothalamus, the hippocampus, and the brainstem. The TNF and IL-1 beta are involved in cellular immunity. They're released early in the sleep cycle during non-REM sleep. They're pro-inflammatory, and they help induce sleep. IL-2, IL-4, and IL-10 are representative of cytokines that are involved in humoral immunity. They're released late in the sleep cycle, and they inhibit sleep. They're involved in the maintenance of immune function. It's thought to be maintenance of the immune function is thought to be one reason for sleep. And in fact, in experiments where we sleep-deprived rats typically die of lethal sepsis. And that's a real simple experiment where rats are kept awake for days at a time. And what happened is that they have breakdown of their intestinal defenses, and they suffer systemic invasion by their own intestinal microorganisms, and it causes them to have lethal sepsis. So sleep deprivation clearly causes the rat to die. So sleep boosts the immune system by producing these pro-inflammatory cytokines, of which IL-1 and beta and TNF alpha are the predominant, but they also produce antigen-presenting cells, naive and central memory cells. Wakefulness, on the other hand, stimulates the hypothalamic pituitary adrenal axis, which is responsible for cortisol and growth hormone production, and the sympathetic nervous system, which produces epinephrine and norepinephrine. These compounds have strong anti-inflammatory activity, and they prepare the animal for daytime activity, not sleep. Sleep supports both memory consolidation in the brain and the immune system. So when we study information during the day, we intake or uptake this information. During slow wave non-REM sleep, we transfer that information into long-term storage so we can recall that information the next day in class or on a test. The same thing happens in the immune system. During our experiences while we're awake during the day, antigen presenting cells uptake antigens that we're exposed to. During slow wave sleep, those antigen presenting cells transfer those antigens that they have picked up in our system to T cells. And these T cells then have memory. So if that antigen is introduced into our system again, we will respond to it in the appropriate fashion. So this transfer of the antigenic material in the immune response occurs during non-REM slow wave sleep. So this is a schematic of the pathways in which the immune system and sleep are integrated. This is a complex side, but the basic is that all of these interleukins and cytokines work through tumor necrosis factor and IL-1 beta, which influences non-REM slow wave sleep. Sleepiness is a frequent early response to acute infections. We've all had the flu in our lifetime, and it seems like every time I get it, first thing I want to do is go to sleep, go to bed. And it's especially during the flu where we see that. Influenza increases non-REM sleep and it decreases REM sleep. And that's characteristic not only of viral illnesses, but also bacterial, fungal, and parasitic illnesses as well. So infection causes increased non-REM sleep, both the duration and intensity. It decreases REM sleep, which actually, interestingly, allows the animal to shiver. During normal REM sleep, our bodies are paralyzed, and the only thing we can move are our eyes and our diaphragms to breathe. And during REM sleep, if we had REM sleep, we couldn't shiver and we couldn't develop as much fever as we can when we shiver. And schematically, if the infection causes altered sleep with increased REM, non-REM, decreased REM sleep, there's change in posture and physiology, which allows increased heat production. This fever then increases the efficiency of the immune system by increasing T cell proliferative response, so they can respond to the antigen. They increase bacterial killing with neutrophils. And also the fever causes the host, the host that's been invaded, to be suboptimal for pathogen replication. And it also changes iron such that the pathogens can't utilize our iron stores for growth. And so the infection not only alters sleep and causes fever, but the altered sleep enables the fever, which enables us to get rid of the pathogen. So it's all kind of linked together. So a patient's typical response to an infectious illness, we call that the sickness response, is fever, fatigue, sleepiness, social withdrawal, negative mood, pain hypersensitivity, and a decreased appetite. And that sounds like somebody who has the flu, doesn't it? I mean, you want to go to your room, cut the lights off, go to sleep, and have nobody talk to you, right? That's typically the way it is. And it's interesting that sleepiness and fatigue are two of the top three things that happen to you when you have an illness, especially a viral illness like influenza. And it's interesting not only for influenza in terms of having acute influenza, but let's look at sleep in vaccine effectiveness. For influenza virus specific antibody titers, 10 days after the influenza vaccination, are twice as high in participants who were allowed to sleep 7.5 or 8 hours on the day they were vaccinated compared to patients with restricted sleep. A single night without sleep on the night following vaccination for hepatitis A, hepatitis B, or swine flu reduces the antigen-specific antibody response by 1/2 at 4 weeks post-vaccination. So sleep is even important in being vaccinated for some of these viral illnesses. So we're looking at sleep and health. The normal amount of sleep generally turns out to be 7 to 8 hours a night. And we'll see many slides that during this talk that really support that notion that normal sleep is somewhere between 7 and 8 hours. 18% of the population has insufficient sleep, and there are many causes of insufficient sleep. Some are sleep disorders, some are lifestyle, occupational alteration. Some of the more common sleep disorders are insomnia, sleep apnea, restless legs or periodic limb movement disorder, narcolepsy, and circadian rhythm disorders. Lifestyle issues include increased work hours, 12 to 15-hour shift in some occupation, increased shift work. How about 24-hour-a-day TV? When I was a child, TV went off at 10:30 and the cables shut down. There was no TV after 10:30. Now there's TV 24/7. And for the younger kids, the internet is a big sleep grabber. That's one, the kids are on the computers and on their phones 24/7, and it robs them of needed sleep. There are about 50 to 70 million Americans who suffer from a disorder of sleep or wakefulness, and it hinders daily functioning, adversely affects health and longevity. The consequences of these sleep conditions include increased mortality, increased morbidity, decreased performance, increased accidents and injuries, decreased functioning and quality of life, decreased family well-being, and increased healthcare utilization. The immediate consequences of poor sleep are things like automobile accidents and work accidents. They happen the day after you don't get a good night's sleep. There are delayed issues, things like obesity, hypertension, diabetes, depression, and cardiovascular disease. They develop slowly over months and years due to chronic sleep issues. Sleep deprivation is associated with accidents at work, metabolic and cardiovascular diseases, and then a cohort study involving more than 10,000 employees in 45 Dutch companies showed that the shift workers, and especially those that work the night shift, have higher risk of infections like colds, the flu, gastroenteritis, compared to those working daytime shifts. Sleep loss can have wide-ranging effects, though, on other systems, like in the cardiovascular system, hypertension and coronary artery disease, more common in sleep deprivation. The endocrine system, we see more diabetes and obesity. In the immunological system, we see more rheumatoid arthritis, fibromyalgia, psoriasis, and lupus in sleep loss patients. And the nervous system issues, we see more depression, mania, and actually alcohol abuse in sleep-deprived or patients with sleep loss. In a huge study called the Nurses' Health Study, less than or equal to 5 hours of sleep was associated with a 45% increase in risk of fatal and non-fatal myocardial infarctions or heart attacks. Similar risks were seen in patients who slept 9 hours. It's thought that the increased cardiovascular morbidity is caused by the increased pressure, blood pressure that occurs in sleep deprivation, sympathetic hyperactivity, and impaired glucose tolerance. Low-grade inflammation causes insulin resistance. It causes endothelial dysfunction, atherosclerosis, and neuroinflammation. And conditions associated with low-grade inflammation include obesity, diabetes, cardiovascular disease, asthma, cancer, neurological diseases like multiple sclerosis and Parkinson's disease. Short sleep duration and sleep disturbance appears to be a trigger of this low-grade inflammation. Profound fatigue is the most common complaint reported in patients with autoimmune diseases, and neuroinflammation is the primary factor contributing to fatigue. Sleep disorders like sleep apnea, insomnia, and REM sleep behavior disorder are associated with higher levels of inflammatory molecules seen in autoimmune disorders. Chronic insomnia is associated with an increased risk of autoimmune diseases. Sleeping less than 7 hours nightly is associated with lupus. Obstructive sleep apnea is more common in patients with rheumatoid arthritis, ankylosing spondylitis, lupus, Sjogren's syndrome, pemphigus, and systemic sclerosis. Multiple sclerosis is associated with an increased incidence of REM-related behavior disorder, and restless leg syndrome is associated not only with multiple sclerosis, but psoriasis and rheumatoid arthritis. So a number of sleep disorders have immunological diseases associated with them. In terms of sleep and obesity, less than 7 hours of sleep a night is associated with a dose-response relationship between sleep loss and obesity. The shorter the sleep, the greater is the obesity. Sleep loss decreases leptin levels and increases ghrelin levels, which stimulate appetite. Sleep loss favors gain through appetite stimulation, the subsequent development of obstructive sleep apnea, which further increases the sleep loss. In this slide, you see here that sleep restricted down to 6 hours is associated with a higher BMI than sleep that's about 7.5 hours is associated with the lowest body mass index. So sleeping less is associated with obesity. In terms of obstructive sleep apnea, cardiovascular disease, and stroke, the odds ratio of developing cardiovascular disease in sleep apnea is 4 times the general population. The odds ratio of developing a stroke is about 1.6 times. It turns out that untreated patients with severe sleep apnea had a higher incidence of fatal and non-fatal cardiovascular events than patients who had severe but treated sleep apnea. Obstructive sleep apnea contributes to the development of diabetes through the development of glucose intolerance and insulin resistance. And it turns out if you treat that sleep apnea with CPAP, it alleviates the glucose intolerance. And obstructive sleep apnea activates the sympathetic nervous system and the hypothalamic pituitary axis and adipocytes, leading to the release of catecholamines, cortisol, and inflammatory cytokines. That's what mediates the development of the glucose intolerance, the insulin resistance, and the development of type 2 diabetes. So as sleep decreases the number of hours of sleep, the prevalence or the odds ratio of developing diabetes goes up by a factor of 2.5. Whereas sleeping 7 to 8 hours, the relative risk or the relative odds ratio of developing diabetes is even of 1. So sleep restriction clearly is associated with development of diabetes. When we look at insomnia, insomnia is more common and severe in females than males, and it turns out that autoimmune disorders like rheumatoid arthritis and lupus, chronic pain syndromes like fibromyalgia, and neurodegenerative diseases like Alzheimer's disease are also more common in females than males. Interestingly, if you take males or females with rheumatoid arthritis and you treat them with blockers of tumor necrosis factor or blockers of IL-6, TNF alpha blockers or anti-IL-6 antibodies improves the sleep of these patients if we block those inflammatory cytokines. Anti-TNF therapy actually improves the sleep of patients with inflammatory bowel disease and ankylosing spondylitis, another couple of immunological disorders. Insomnia increases the risk of depression, hypertension, and type 2 diabetes. Insomnia itself is directly linked to immune and inflammatory dysregulation. Studies suggest that sleeping in on the weekend or having multiple days of recovery sleep may help resolve inflammatory modifications due to acute sleep loss, and napping appears to be an effective countermeasure that supports the recovery of immune changes induced by acute sleep loss. So documented decreases in the mean duration of sleep, an increase in shift work, working longer hours, sleep loss, and sleep disruptions have become occupational hazards in our country. As the population sleeps less, the burdens of society in terms of economics, accidents, and disease increases. Unraveling this relationship between immunity and sleep, being sick and tired, has important implications for understanding the basic science of sleep and the immune response. So here are a few tips for getting a good night's sleep. It's best only to sleep when drowsy. Don't go to sleep when you're not sleepy. It's really a waste of time. Maintain a regular wake time. That's probably one of the most important things we can do to improve sleep overall. We get up at the same time every day, whether it's a work day, a weekend, a day off, or our vacation. If we maintain a regular wake time, being drowsy at night when it's time to go to sleep will take care of itself. Avoid napping during the day. If it can't be avoided, it's best to limit naps to less than an hour and no later than 3 p.m. We really need to stop using computers, cell phones, or other electronic devices with a bright screen that shines light in our eyes at least 30 minutes before bedtime. That light will produce wakefulness or keep us awake. We need to avoid caffeine within 6 hours of bedtime. That's kind of a general time period. Some people are really sensitive to caffeine. And if they have caffeine anytime after lunch, they won't be able to sleep that night. So there's some individual variability with caffeinated products, including beverages, coffee, or chocolates that have caffeine in them. But 6 hours, caffeine's a stimulant. Same thing about nicotine. Nicotine's a stimulant. Well, nicotine needs to be avoided close to bedtime and during the night. If somebody wakes up in the middle of the night, not the time to smoke. It'll produce wakefulness. Alcohol, although alcohol does make the initiation of sleep easier, the alcohol, as it's metabolized, causes sleep fragmentation. So a night of sleep after alcoholic beverages are consumed overall is not as consolidated as a night of sleep without alcohol. So it's advisable not to drink within alcoholic beverages within 4 to 6 hours of sleep. A light snack before bedtime can help promote sleep. And typically the light snack usually composed of a dairy product like milk and carbohydrates. So what grandma always told you, milk and cookies, right? That's a dairy product and a carbohydrate. A light snack works. We need to avoid large meals before sleep. The act of digesting can disrupt sleep, so we don't want to consume large meals. We need to minimize light, noise, and extremes of temperature in our sleep areas or our bedrooms. We want our bedrooms also to be as safe as possible. We don't want to use the bedroom only for sleep and intimacy. You really don't want to have your bedroom as the place to watch TV in your home. The bedroom should be a place for sleep. You don't really want to have the bedroom, and the den combined, so to speak. You want to be a bedroom, a place that you associate with sleep. If you're unable to sleep, it's best to get up and leave the bedroom and go somewhere else in your house, apartment, or wherever, and engage in quiet activity outside of the bedroom, but it's best not to fall asleep outside of the bedroom. That means if you can't sleep, get up and go in the den, go do something productive, wash clothes, wash dishes, do something. And when you get sleepy, go back to the bedroom and try to sleep. Avoid strenuous exercise within 6 hours of bedtime. Strenuous exercise close to bedtime it stimulates wakefulness. And lastly, if you feel you've developed a disorder of sleep, see a sleep specialist. It likely will not go away on its own. It's time to do something about it if you feel like you've developed a sleep disorder. So good sleep is necessary for mental and physical health, and I'll stop there and take any questions anybody has.